So for microtia and atresia treatment, basically among the many, there are two options that we have. One is use of the rib cartilage to make the ear, and the other is the use of the synthetic material, MEDPOR, OmniPOR, SUPOR, whatever you want. So we perform both. It's not like we do only one. We perform the rib and also the MEDPOR. And not only that, we perform the surgery for hearing improvement along with the rib reconstruction and also along with the MEDPOR. Usually in one single stage, but in well-selected cases. Another difference I want to point out, that I as a surgeon, single-handedly, I perform the ear reconstruction as well as the hearing as one person. This allows much better planning and precision and therefore better outcomes. I will show some photographs of both the rib construction and the MEDPOR. These are the rib cartilage reconstructions that we make, and this is all in one single stage. This is the framework from the rib cartilage that is made and then implanted into the patient for a perfect looking ear. Sometimes the deformity looks big, but we have a lot of innovative surgeries to make it into a single stage good looking ears. A small word about trauma. Trauma is very, very simple to repair, and it's possible to give a normal looking ear after majority of trauma cases. Now let's compare the rib cartilage with the MEDPOR, which is the real discussion topic. When you use the rib cartilage, you use your own tissue, which means that a lifelong survival of the live tissue is guaranteed. For 100 years, once the healing is done, this ear will not give you a problem. If after 50 years you get an injury on an ear that is made by the rib, the ear will heal itself. So the MEDPOR is a synthetic material, so we don't know if it can last for 100 years. If it gets injured, it cannot heal itself. The advantage of the rib cartilage is you can make a design, you can custom make a design to the opposite normal side. The MEDPOR comes in a standard design, same model for every child. Most importantly, the rib cartilage uses the local skin near the ear. This allows a natural feel, a natural touch sensation. The temperature and the look of the skin is the same as the face. The MEDPOR ear does not use the local skin. You have to use a skin graft, and the grafted skin has no sensations at all. Again important, when we use the rib cartilage with the local skin, this ear will age well with time. As the face changes with age, 50 years, 70 years, so also will the skin on the ear change with time. The grafted skin will not age with time. This is just to show you the photos of how the natural skin looks in terms of the feel and the sensations, the moisture, the oil secreting glands are there, so that the shine is absolutely nice and normal. So the rib will not have any extrusion problems for 10 years, 20 years or 80 years or 100 years. So our aim should be to give him an ear that will last for 100 years. When we use the MEDPOR, we have the possibility and the threat of an extrusion. It is very high and it is there for life. The shearing forces between the MEDPOR and the skin, because the graft is senseless, the possibility of breakdown is very high. What happens is, if the MEDPOR gives you a trouble of exposure, one is it can get exposed. If it gets exposed, it cannot heal, so you need one more operation to repair the exposure. Not just that you need the surgery, but you need it urgently. And this can happen anytime, even 30 years after surgery. Maybe on the day of his marriage or maybe on the day of his interview. You have to keep this possibility in mind. All MEDPOR ears look the same. So they are like robots. You don't have, the child does not have an individualism. The child does not have an ear that is his or her own. It robs you of your individualism. And this can have severe impacts not in childhood but in adulthood. So we have to make them an ear which will make them happy in childhood, but also proud in their adulthood. Sensations are very, very important. The warm touch of a beloved, when somebody touches your ears, there is affection and love. The child or the adult should be able to feel the warmth of the breath of one's partner during interactions of intimacy. They should be able to feel all of this. The MEDPOR ear has no sensations. If an insect bites an ear, it can be dangerous. In extreme colds, you cannot feel the cold on the ear. Regarding the aging, we already made a point. If you use the MEDPOR when your child is 70 years of age, the ear will still look like it is 5-year-old. Why does this happen? The result of MEDPOR lies in this flap that is circled here. Normally the blood flows from down to up. When we use the MEDPOR, we use this flap and we turn it in an opposite direction. So it has nothing to do with the skill, because the framework is ready-made. It all remains a chance of how much blood will flow in the opposite direction and for how long. So most complications of MEDPOR are at the distal end where the blood flow is at the least. You need a good size of length and breadth. This is very important when you're using the MEDPOR. The question is, do I use the MEDPOR? Yes, of course I use the MEDPOR. Do I prefer to use the MEDPOR? So my answer is no, for all the reasons I gave you. But there are some cases where you cannot use the rib, because the MEDPOR has to be always covered with this